Hello and welcome back to our series for reversing your knee pain problems. This is our tips and tricks edition, things that we recommend for our patients and recommend for you to take a look at. So with regard to the knee, some of the safest and easiest things that we can do is stretches. So today the topic will be stretching. So with regard to the knee, we want to take a look at the muscles all around the knee, and that's going to be your quadriceps, that's going to be the hamstrings on the back, and that's going to be the calf muscles. So here's some easy stretches and some things you can do. As always, you might want to contact your physician to make sure this is safe, but generally these stretches are pretty safe. So for most of my patients, I'm recommending stretches to the quadriceps up here. Most of my patients will have to hold on to something. We don't want to lose our balance. You're going to lift your leg up here like this. Usually it's with a pant string or pants right here. You hold on to the pants right here and you lift up. The idea is stretching out the quadriceps. The quadriceps go from the hips all the way down to the kneecap, and then the kneecap crosses into the patella tendon. So we want to get some stretch here. How long? So we want to hold this in the beginning maybe 10 seconds, 20, but eventually getting up to 60 seconds there. The idea with that is we want to elongate this, allow as much flexibility and range of motion of that knee as we possibly can. And I find on most of my patients that the tightened quadricep muscle, as a result of the body doing this in a protective mechanism, is preventing the knee from getting better. Okay? So if I were to take your finger and my hammer and slam your finger like that, and you would feel a lot of pain in the finger, that's called a 10 level of pain. Definitely don't want to stretch up to a 10. You want to take it up to maybe a 3 or a 4 at max, and you're just going to hold it at that level. And you should notice over time that here it hurts at a 4, but then over time it gets a little easier, so then you can pull a little more. Hurts again, and then you keep pulling a little more until you eventually get this thing stretched. You get up to your 60 seconds. If it takes you, 2 weeks, 3 weeks, or 4 weeks to get up to the 60 seconds, that's fine. Just slowly go into it. If you ever feel the muscle starting to spasm up, and it will do that, then you got to let it go, let it out a little bit. Don't overdo it. The next side is the back side right here. That's going to be our hamstrings. That has to do with the knee as well. That one here we can do with our knees bent, like leaning on something like maybe your bed. The idea is that you want to feel the muscles, the hamstrings tightening up. So you're just leaning right here. Eventually the goal of these are straight leg, excuse me, and then you want to get all the way down. Eventually you're going to be touching your toes. Will you do that on the first, second, third, or fourth visit, or time doing that, or fifth week? No, it might take you 6 months to a year to do that. Always listen to your body. If it's hurting a lot, back off, back off, back off. If you ever have pain traveling down the leg, there might be a nerve irritation, so we want to know about that as well. The last thing to do for our tips today is to stretch out the hamstrings, and darn it, I don't think you'll be able, or hamstrings, the calf muscles back here. You can't see this, but what I'm doing is I'm lifting up my foot onto a wall or something like that, and I'm just kind of rocking forward, the idea being that you're feeling your calf muscles stretch out. And it's the same concept on that. You want to take it into a level of a 3, maybe a 4 level of pain, and just working with it, allowing that muscle to lengthen, lengthening the muscles. Whether you end up doing my program or another program, that is going to be a really, really good tip, because we want to get as much flexibility, pliability in those muscles. That's just going to make for a healthier joint. So I hope this helps. Give it a try. As always, if you'd like to consult with me, feel free to give us a call or hit reply here. The number is 434-977-5433. We have a video testimonial below. I hope you enjoy that, and I look forward to chatting with you real soon.